All right, this is big picture anatomy with a mid-sagittal view of the head with a look at the nasal, oral, pharyngeal, and laryngeal regions, or basically the face and throat regions. What we're looking at is a cut right down the middle of the head, but of course there's a couple of things that wouldn't be seen, like the eye, the ear, and the nostril would actually be off to the side, out of the plane of the screen, but they're on the drawing just to give some perspective as to what we're looking at, or to not have a bunch of shapes without any idea where we are on the head. We've got the brain, as a good developmental biologist, outlined in that ectodermal blue with the spinal cord coming off of it. We have the vertebral bodies just anterior to the spinal cord, and the spinous process of the vertebrae just posterior to the spinal cord, and of course that spinal arch would wrap around each vertebra, but it's out of the plane of the drawing, and then these are those epaxial muscles that move the vertebrae. We've also got the brain being held in place in the cranial cavity by the floor of the brain case, and what you can see here are those main three bones that support the brain: anteriorly the ethmoid bone, in the midregion the sphenoid bone, and the temporal bone. All right, let's focus for a minute on what's happening in the facial region. The hard palate is what we think of as the roof of our mouth that would be separating the nasal passage from the oral cavity. The nasal passage up here from the oral cavity down here. It's got this soft palate extension on the end in life that you wouldn't see on the skull. The hard palate itself is made from the maxilla bone and the palatine bone most posteriorly, and right at the front we would see the front incisor that we would cut through at the midline. Of course, the dental arcade would come out of the plane of the drawing and into the plane of drawing on the right side and the left side. Now, just superior to the hard palate is the nasal passage, where air comes in through the nostril and into this region and back to the throat. In life, this would not be one big open space, but it would be filled by those turbinate or bones or conchae of the ethmoid bone, lined by a mucous membrane. This would be a, as you can see here, a stratified squamous epithelium lining the nasal cavity, and what that mucous membrane does is helps to humidify and filter and warm the air on its way down to the lungs. Now, just inferior to the hard palate is going to be the oral cavity. It's going to be dominated by the tongue, which is going to be the large muscular structure in the middle of the oral cavity coming off of the mandible. The mandible here we're seeing cut right just at the mandibular symphysis or midline, with the lower incisor coming off of it. The rest of the lower dental arcade would be coming out of the screen on the right side or into the screen on the left side. So the tongue is anchored on the mandible and on the hyoid bone, posterior and a little bit inferior to the mandible, and skeletal muscle filling the tongue, filling the oral cavity, and all of the oral cavity, the roof of the mouth, the tongue, even the gums, lined again by that stratified squamous epithelium. It's basically skin that's involuted into the oral cavity. In this case, it's secreting saliva. In the oral cavity, it's secreting mucus. To continue, let's take a look at what's happening down in the neck region. Here, we can see the esophagus. Well, let's say this. The nasal passage and the tongue come straight back to the pharyngeal region, and if we look inferior, we'll talk about that more in a minute, but inferior to the pharyngeal or pharynx region, we've got the esophagus right up against the vertebral bodies, and that would take food and water to the stomach, and then pouching off anteriorly to the esophagus or ventrally to the esophagus is going to be the trachea, which would take air to the lungs. The trachea is surrounded by these cartilaginous rings or tracheal rings that make it look very much like a vacuum cleaner hose, and at its cranial end you're going to have the structures of the larynx, the cricoid cartilage, which is a bunch of fused tracheal rings, the thyroid cartilage, which looks like a shield because it's just across the front of the trachea, and the epiglottis, that part of the thyroid cartilage that sticks up above the glottis or the opening into the trachea. All of those three structures, the epiglottis, the thyroid cartilage, and the cricoid cartilage, form the larynx. Now, what happens? When we breathe air into our nasal passage, into our nose, it comes through the nasal passage and through the open epiglottis down the trachea and into the lungs. When we take food and water into the oral cavity, it gets processed by the teeth, moved around by the tongue, and eventually swallowed back into the pharyngeal region. The pharyngeal constrictors help to continue that swallow into the esophagus and down to the stomach. However, so that none of the food or water gets into the trachea, the larynx is moved superiorly, forcing the epiglottis over the top of the larynx and hopefully forming a seal so that nothing can get into the trachea. If any food and water does get lodged or into the trachea, we have choking, a minor event if it doesn't totally seal off the trachea and you cough it back out. A major choking event, life-threatening, if you get something lodged in here that seals off the trachea and you can't breathe. So, just to recap, we're looking at a mid-sagittal view of the head with a focus on the nasal, oral, pharyngeal, and laryngeal regions. The structures of the face and the throat. The hard palate with its soft palate extension separates the nasal passage from the oral cavity. And coming off inferiorly, you've got the esophagus posteriorly against the vertebral bodies with the trachea pouching off anteriorly. Air moves through the nasal passage into the pharynx and into the open glottis, or opening the trachea to the lungs. Food and water move through the oral cavity where they're processed and then swallowed into the esophagus over a closed trachea that has been moved up superiorly, causing the epiglottis to cover over and seal it so that the food and water get swallowed into the esophagus and down to the stomach. That then is a view of the mid-sagittal head from Big Picture Anatomy.